the Dark Ages, a period of collapse, chaos, and violence. Or was it? New discoveries are helping to challenge that idea. After centuries buried beneath the soil, the graves of Anglo-Saxons are unlocking the secrets of these elusive people, revealing a civilization far more complex than history often remembers. I'm medieval historian Matt Lewis, and I'll be joining osteoarchaeologist Dr. Joe Buckbury at the University of Bradford to investigate the remains of 3 individuals who lived and died in Anglo-Saxon England, and who, in death, may help reveal the truth about life in early medieval Britain. Team Cold Case, don't go anywhere. Stick with us right to the end because we've got a genuinely extraordinary update on our very first investigation, including new revelations about the mysterious warrior who may just have been felled by a trebuchet. Trust me, you're going to want to hear this. So Joe, what do we have for our first skeleton today?
So this is an early medieval individual from Eccles in Kent. And the cemetery was on top of a Romano-British villa, but it dates to the early medieval period.
Lodged in time between the fall of Rome and the coming of the Normans lies a forgotten age, the early medieval period, often referred to as the Dark Ages. It's here, in a land populated by Angles, Saxons, Jutes, Celtic Britons, and Viking settlers, that the foundations of modern Britain were first laid.
So when we're talking early medieval, we're going to go with Rome evacuates the British Isles in about 410. You've got the arrivals of the Anglo-Saxons and the Jutes over the 5th, 6th centuries. The Vikings will arrive towards the end of the 8th century, and then we've got 1066 with the Normans coming. Yep. So we've got that kind of span.
Yeah, the sort of like 410, 450 through to about 1066. Well, this individual is kind of in the middle of that. So more specifically, we're looking between the 7th and the 10th century AD. So we're looking at the period after the conversion to Christianity, or just as that conversion has taken place.
When we think about who this might be, what I very much remember from last time is that we go straight to the pelvis if we're trying to work out if this is a male or a female.
Yep.
And if I remember what you taught me rightly last time, it's this bone here and having that kind of UV shape suggests that this is a male?
Yep, absolutely. I mean, ideally, we'd want the pubic bone, which would be sitting in here. But as you can see, this individual's not very complete. Doesn't have any arm bones, doesn't have lower legs and feet, and quite a lot of damage in the pelvis. So we're missing one of the key sex indicators, which is frustrating. And that's because there was a lot of plough damage at this cemetery. There's a lot of individuals that are quite complete. This is one of the more complete people in a lot of ways. But yeah, so absolutely in this case, because I'm missing the bone at the front, I'd be going straight in there, and I would agree with your male.
Excellent. Pass the first test.
Pass the first test.
What might we try to establish what kind of age this person was when they died?
Well, again, if I had it, I'd be looking at pubic bone. But I can look at the appearance of this joint in here, which is the sacroiliac joint. So this is the joint between your pelvis and your sacrum at the back of your body. I can also look at this ridge on here, and I can see that this has fused. So this edge here is actually connected to the bone, which tells me a little bit older. And I can also look at the wear on the teeth. And this is basically telling me, when I look at everything, this is a younger adult male. So probably somewhere like 20 to 30 years old.
And is there enough of his remains here to work out what might have happened to him, what caused his death? Absolutely.
This is another one of those trauma cases. So we have a lot of sharp force trauma in this case. So things that have come from a weapon with a blade, a sharp edge to it.
And that really plays into our notion of that early Anglo-Saxon period in which we think everything is quite lawless. Everybody is running around with a sword, hitting everybody else, desperately trying to get land. And here is someone who has died in exactly that way.
Yeah, I mean, you've got a period with multiple battles and skirmishes taking place. The vast majority of people did not die in a battle, and certainly this cemetery, it's not a cemetery for a battle. It does have a few individuals with the trauma, but but it's a community cemetery with a broad spectrum of people, children, women, people who died in their old age, various diseases. But we have a few with injuries like this, including this particular person.
So this is someone who, even if he died in battle, he was taken probably back home.
Yeah,
be buried.
and buried with his community in his community cemetery. Yeah.
What kind of injuries can you show us on here that demonstrate those battle wounds?
Well, given that we're starting down here, I'm going to start actually with the pelvis, and hopefully what you can see, these two pieces do connect together, but it's a little bit snug, but you've actually got this very straight edge just across here, and this edge in here is really polished. So this is a blade injury that's coming through the pelvis.
That's coming
right
kind
at
of
the
waist.
sort of top of the hip, just below the waist. And there is another one on this side, and you can see this sort of more shallow cut just in this point here. So that one's looking more in sort of butt region.
So that's two different
wounds
as well.
in the pelvis.
So this is someone who has taken several wounds before he's
Absolutely.
been killed.
So we've also got injuries to these vertebrae in here. We're looking in the lumbar spine, so the lower back, and we've got another cut injury in here. The surface isn't as nice as I would like it to be. There's a bit of post-mortem damage, but it's absolutely flat. You can see just how straight it is if you get the angle right. There is a similar appearance just in here, and it's exposing the sort of trabecular bone on the inside. So we've got lots of small struts of bone, so it's harder to see the cut marks, but that is again perfectly straight. And then this one in here is another injury coming from a different direction. So there are a few.
Potentially more than one attacker at this point as well.
Certainly more than one injury, potentially more than one attacker. It's hard to say whether or not it's one person having a bit of a frenzy or multiple people.
Is there any way of telling from those injuries, is this someone attacking from behind?
These injuries, they're happening on the back of the vertebrae, so those are from behind. And certainly this one is from behind. Harder to tell with this one, but my gut feeling is this one's coming from the front, just because this edge is so much more sharp, which tends to be where the first point of impact is. But we have a lot of post-mortem damage here, so it's kind of difficult to be certain about that particular injury.
So this is beginning to feel like someone who was either surrounded or perhaps was trying to escape.
Yes.
After an initial injury perhaps, and was chased.
Absolutely, and it's that kind of frenzied fighting. You don't stand facing each other and very nobly fight just facing each other. It's a much more frenetic type of experience.
But a terrifying experience for a young man in his 20s. He sustained a battle injury. He's perhaps trying to get away to save his own life.
Yes.
But he's being pursued and hacked from behind until he's brought down.
And the injuries become even more brutal to a certain extent when we look at his skull. But before we get there, I just want to show you a few other ones. It's time in the ribs. And I think I was particularly interested in this rib here. So this fragment, again, you've got a really sharp cut right the way across that particular rib. It's very, very clean on this edge. It's actually broken away. You can actually see there's a fracture running up the length of the rib with this roughened edge. This kind of tells me that the direction is coming from here and it's separating and crumpling in here. So again, this is coming from the outside of the rib cage. Because it's this tiny little fragment, it's really hard to say if it's at the back or the side or the middle.
How can you tell the difference between something that happened with a sword while he was alive and something that's just a bone being broken in the ground?
Great question. So actually this piece directly next to it, you can see these edges. Well, first of all, they're very pale. That tells me that that area of bone hasn't been in touch with the soil for as long. So it's kind of, when it's broken, it's paler in colour, but it's very irregular and the texture is all over the place. So it's not that smooth, straight cut that we see with this one here, but it's also different to the appearance in here because this is also perimortem, but it isn't a cut. But you've got a sort of regular texture to the bone surface in here when you look at it, particularly under magnification, whereas this is really jagged and irregular.
I think even without magnification, you put them next to each other, you can
really see the difference. So if I just look over here, another very similar sort of thing. In this case, you can see the cut on here, but post-mortem, perhaps this is one that went part way into the rib, and then the weapon was pulled out and it didn't fully fracture. And then in the burial environment, because you've got the weight of the soil on top, that's kind of snapped off. And so we've got a mixture of something perimortem around the time of death.
And a really clear contrast on the same piece of bone there.
It just reinforces what we've just looked at, this one over here.
Perhaps that cut's weakened it so that in the grave it's...
Yeah, absolutely. In any of this kind of trauma, it's weakening the bone, increases the likelihood of further fragmentation, which is why we have to look really carefully at all of the broken surfaces and not just assume something happened in the burial environment.
Yeah. I mean, I'm finding myself feeling quite sorry for this young man. There's several injuries there, some from behind, painful broken ribs as well, but you mentioned there's worse to his head?
Yeah, the injuries to the cranium are really quite dramatic. This cranium was quite fragmented in the burial environment. Not long after excavation, pieces were stuck back together with adhesive, but it's not survived as well as we would like. So in some cases, pieces have since come away. We'll start off looking at this piece in here, and this has been reconstructed to a certain extent following the excavation. It was quite highly fragmented, and what we can see first off is this kind of glancing blow on the top of the cranium. So your cranial bones come in three layers. We've got the inner table, which is cortical bone, it's quite dense. We've then got a spongy layer in the middle, which is called the diploic space, and then we've got the cortical bone on the outside, or the outer table. So this is actually cut through the outer table and exposed that diploic space. So these are the diploic, that spongy open material. So that's kind of an injury that's basically taken off that layer, and it's very, very smooth at this side in here. This is actually quite polished. But when you look up here, can you see that's a little bit more textured?
Yeah.
So again, that tells me a little bit about the orientation, that it's kind of coming in this direction. And then that's the end of the blow where that flake has come away.
That's again from behind.
We have a similar injury just in here, and again the roughened edge is over here, so the blade is coming in that particular direction. And then to the back of the cranium, we've got these three really dramatic sort of hacks, really is perhaps the best way to describe it. They're basically sectioning the back of the head. So that's really quite frenzied, really, really brutal. And in this case, it looks like it did go all the way through the bone. We've got little bits of damage on the inside. You can actually see the three layers of bone in that edge, but it's coming all the way through that side. So that is something that's going to then be impacting the brain as well as the bones themselves. So really, really quite dramatic just on that piece. There are other smaller injuries to the base of the cranium, but also to the mandible. So if we look in here, we've got an injury just in here. This one doesn't look as sharp. It looks to me like there's been a force applied in here, and that could have come from a blade that hasn't cut in, or it could have come from some other weapon. But this is a perimortem fracture, and we can tell that because of the texture.
So that's essentially breaking the bottom of his jaw.
Yeah, so and at the front, just towards the front of where your ear is.
And perhaps with a different weapon from the slicing of a sword.
Potentially.
Or a crushing weapon, possibly.
Potentially, or it could be that a different part of the sword is being used. You know, people don't always use the cutting edge. So just because a weapon is a bladed weapon doesn't mean it will only cause sharp force trauma. It could also cause blunt force trauma. And also, you don't know if there's anything cushioning them. So, you know, if they had some kind of a helmet and this blow happened, and then perhaps it's been, you know, lost, or these blows are much more significant at the back. I think the ones on top suggest that at this point there is nothing protecting the top of the head up there. We need to do a lot more experimental work to figure out the impact of armour and protection against this kind of injury.
Yeah, so I guess what you can't tell is what he was wearing at the time.
Absolutely not.
And so that could be a sword that didn't quite get in very far, but it could be someone using the pommel of a sword to smack him around the jaw, to knock him unconscious or something like that, or the haft of an axe or something like that.
Yep. We can tell that he died from these injuries. There's no evidence of healing, and the quantity of them, the orientation of them, really it's not consistent with somebody surviving. This is really quite brutal.
And given that it's not a complete skeleton, do you have a sense of how many injuries you've been able to identify on what we have?
We've noted 30 different injuries, and actually the one that most definitely would have been fatal, had this person survived all the others, is actually in the neck. These 3 fragments here are actually the first vertebra of the neck, so the first cervical vertebra. And in this case here, this has been bisected and separated through, and that is the potential a decapitation blow.
If he's not already
dead,
finished off.
This would have actually, absolutely finished that.
I mean, it feels like a really horrific way to go that is really reinforcing that idea of this early medieval period of England being a bit lawless and wild. But I'm also struck by the fact that you mentioned this person was taken back to be buried in a community graveyard. He was taken home.
Yeah, absolutely. So I've actually got a diagram of the cemetery. And so these lines in here, these are the rooms of the Roman villa that predate the cemetery. And you can see that we have this cemetery in here. What's really interesting is you can see that all of these graves are orientated approximately west-east, typically with the head at the west end of the grave. This is very characteristic of the sort of middle-late Anglo-Saxon cemetery type.
So we're looking at Christian burials, head to the west, so that when you sit up on the Day of Judgment, you're facing east, you're facing Jerusalem.
Absolutely. And what's really interesting for this cemetery is there are actually 3 layers of burials, and the earliest layer, there's about 24 individuals, I think it was, had some form of a grave good. And they're the kind of thing that we see around about the time of documented conversion of Anglo-Saxons to Christianity. So that gives us an early date of the 7th century for this cemetery. And then if you move to the top layers, we're looking at more like the 10th century. So we have about a 300-year use for the site. And our individual, he's buried just out here. So he's a little bit away from all of the other individuals. There's two people in this little ditch around here. That could have been a deliberate placement, that they're still within the community cemetery. There's a bit of otherness about this individual, so they're separate slightly. But we need to bear in mind there was an awful lot of plough damage. So whether or not we've lost anything is hard to say, because they're in this ditch, perhaps they're a little bit deeper. Unfortunately, the cemetery records are not good enough for us to be able to establish that.
And I find it quite interesting that there is a sense of continuity about this, that you've got this old Roman villa there, and that after the Romans have gone, people are using that site still. They're living nearby enough that their cemetery is adjacent to that old Roman villa. There is a sense that people are staying in that place.
There are a few hundred years between the abandonment of that villa and the reuse of it as a cemetery. So it's not so much continuity through that period, but reuse of a site. And we see this quite a lot throughout the early medieval period, that people are using earlier monuments, earlier buildings as a focal point for a cemetery. So we see the reuse of barrows dating to the Bronze Age or the Neolithic or the Iron Age for cemeteries of this period elsewhere in the country, but also Romano-British places like this.
Yeah, incredible. Well, that was so interesting. I'm really struck by how easy it might be to forget that these skeletons were once real people. That's a young man in his 20s. I've got sons that age who's received 30 battle wounds, some of them from behind. He's either surrounded or he's being chased and attacked from behind. Either way, this is someone who died scared. It reinforces that idea of this Anglo-Saxon period as brutal, as full of fights and battles and a need to survive. But against that, we can place the fact that he's taken home to be buried, back to his community, that there were people who loved and cared for this young man. So Joe, this is our second skeleton for today. Where on our early medieval slider can we place this one?
This cemetery, which is from Northamptonshire, dates to the 10th to 11th century, so right towards the end of that sort of timeline that we talked about earlier.
And given that we've met at the pelvis, I'm going to start here and again, look at that U shape that I can see in there and say that I would suggest this would be a male.
Absolutely. And what's really great here is that we've also got the pubic bone, which is this one here. And so that allows us to assess the sex, looking at the angle, and also the fact that we don't have a ridge running up that side.
And looking at the tops of these bones as we did on the previous one, they look fused to me, so maybe a similar sort of age, an adult?
Definitely an adult, although I would say the fusion is only just finishing. So there's a slight depression running around here. And we have these much more recently fused with a bit of a gap.
Yeah, you can just see those there. So do we have any sense of what might have befallen this? This is another person who's passed away probably in their 20s.
So in this case, we're looking at somebody who had leprosy. And the first place to look for that evidence is on the upper jaw. So if we look at this area in here, we've got the porous bone, new bone formation. We've got rounding of the nasal margins and then loss of the area just in here, which is called the anterior nasal spine.
So we're talking about the area kind of at the bottom of the nose and around the top of the lip. Is this something that would have been clearly visible to people who met this person?
Potentially. So what would happen with this sort of skeletal change, you may see a sort of a dipping of the nose, a sort of a less prominent nose. And associated with this, we would have sort of nasal stuffiness, perhaps a hoarse voice, but also skin lesions. So early on, you get patches of paler skin, but later on, and certainly when you're seeing this kind of change, you like seeing nodules of hardened skin on the face, which are really quite distinctive.
So if this has given us an indicator of leprosy, are there other places that you would look on a skeleton to try to confirm that?
Yep, so the next place to look for this person would be the hands. What we have in this bone here are the little depressions caused by the pressure of those hands are sort of flexing in.
Yeah, you can kind of see a little dip worn in there, and that's just from a prolonged period of having your hands stuck like that and the bones rubbing together.
Yeah, absolutely. And you can see there's a slightly more obvious one on this one as well. Yeah. So this suggests this person had a claw hand deformity.
Which presumably makes it harder for them to function as a member of society, to work, for example.
They probably did get around this. People are very, very adaptable. And so they may have been using their hands in a different way, but there are some things they may not have been able to do, certainly in the same way as you or I might do it. But some things may have been a little bit more challenging and difficult.
And is there any other indicator on the skeleton of leprosy?
The next place we'd look for in a case of leprosy is the feet. And that's because the Mycobacterium leprae, the pathogen that causes leprosy, likes cold areas of the body.
So we've gone for extremities, we've gone nose, fingers, toes.
We see features in the feet that this person doesn't have. So we're not seeing thinning of the toe bones, we're not seeing loss of the heads of the metatarsals. They've been lost post-mortem, but there doesn't seem to be anything associated with that there. But what we do have is new bone formation, and you can see an area just in here where it's porous.
Oh yeah, so it's a different texture and a different colour.
Yeah, absolutely, and you can kind of see the difference.
And what do you think would be causing new bone growth on a foot there?
If you injure that foot and you don't know that you have an injury because you can't feel it, you might get ulceration and you might get infections coming in through that open skin. And that infection can then track its way up the body. And so this person, we've also got quite a lot of bone formation on this heel bone, the calcaneus, but also into the lower limb, sort of particularly on this fibula. You can see large areas of bone formation right the way up, and there's very little of the original bone surface present just at the top, but down here it's very, very altered in its shape.
So that suggests a really serious infection has got into this person's left leg and presumably is causing them discomfort, pain, making walking quite difficult?
Yeah, I mean, the walking quite difficult may come from nervous loss, so things like the loss of proprioception and due to the nerve damage in the feet. This is associated with swelling of the legs, so edema. To what extent it causes pain will depend very much on to what extent the nerves of the leg have been altered, but the likelihood it would have been painful as well. And so this, so I'd call it inflammation rather than infection, but the likelihood in leprosy that this is an infection, if we just saw this on its own, we'd be talking about an inflammation. But it looks in this case, it's actually tracked up and is also affecting that femur.
And that is strikingly different. There's
Absolutely.
something about that bone even I can see.
Yeah. So if I pick that one up there, you can see it's massively increased in size due to lots of new bone formation. And we've got a little area just in here where we've got some post-mortem damage, which is unfortunate in terms of bone preservation, but it allows us to see multiple layers of bone forming one on top of the other on the outside of this femur.
So it's almost like if you go to the beach and you see those kind of slate cliffs where you can clearly see the lines in them, you've almost got that effect there of bone growing on top of bone where it's healing.
Yep. And in this case, because it is so enlarged, there's a chance that the infection is also impacting the bone cortex itself. And so that could become increased in size as well, increasing the breadth of this bone.
So that's swelling from the inside of the bone, pushing it all out, which sounds really painful.
Nasty stuff.
Leprosy isn't particularly contagious. Do we have any kind of idea of how this person may have contracted leprosy?
So that's really interesting because we did a study jointly with Manchester, and from that we were able to identify the specific subtype of leprosy that caused the disease of this person, and that's subtype 3K. And today this is found more in East Asia. Archaeologically, it's been identified in Hungary, it's been identified in Turkey, and also a little bit later on in the later medieval period in Denmark. So that's suggesting that this particular pathogen has come from the East rather than being one that's seen elsewhere in Britain.
So he may have contracted it or contracted it from someone who's been to those kinds of places. But either way, that really speaks to the connectivity of the early medieval world, that a disease that is present mostly in East Asia is finding its way to Northamptonshire in England. And you've got kind of all of these routes that knit that world together. There's the Silk Road trade routes, but you've got the Vikings who are coming over to raid and get lots of easy gold, but they're also collecting slaves who they are moving to the east as well along that line. And with early Christians, you've got pilgrims heading off to the Holy Land. And that's aside from people who are just doing business. There's lots of reasons that we could have this individual travelling so far east that he's picked up a form of leprosy that you wouldn't normally see in Britain.
Yeah, and we need to bear in mind that we may have other cases of this strain in Britain, but they've not been identified at this point from the data that we do have. But certainly it's looking more likely that this pathogen came from the east, and perhaps this person was the one who did the travelling, or they knew somebody else who carried that pathogen back with them and they caught it from them.
But again, like our first skeleton, it's quite striking that for all of the stigma that we might think is associated with leprosy, this is someone that you said was buried in their community still.
Yeah, and I've actually got a grave plan. So this is a plan of the Rawn Cemetery, and you can see we've got a church smack bang in the middle. And then we have all of these burials. They're west-east aligned, they're lying on their backs, extended, very much in the Christian fashion. And this individual was buried just down here. So he's within this community cemetery, but he's about as far away from the church as you could get within that. So it's kind of a little bit more marginal. And what's really noticeable to me is that there are other individuals who are buried in that location who also have some form of physical impairment, and that's these three here.
This is still within the bounds of the churchyard. He's buried on hallowed ground. He's still part of the community. It perhaps speaks to someone who was less able to contribute to the community. He perhaps wasn't as wealthy or politically important as some of the people who are closer to the church or making their way into the church. But despite that inability to contribute quite so much, they are still members of the community who are buried on hallowed ground.
With everybody else,
of that community. That second individual, much like the first, is another young man, someone who possibly didn't make it out of his 20s. The big difference, I guess, is in the first individual's case, he suffered a lot of violence and no doubt fear, all in a short space of time on one day. This is someone who has contracted leprosy and suffered, possibly struggled for much of his short life, not being able to be the active member of his community that he might have wished he could be. We can't be certain what caused this young man's death, but we can be sure that he suffered and struggled during his lifetime. And like our first case, I'm struck that whatever happened to him in life and however he met his end, he was ultimately embraced by the community around him. He's buried on hallowed ground with the people that he'd lived with. We quite often think of the early medieval period as brutal, where people are disconnected and it's every man for himself. But here is a community who have shown in death care and respect to one of their own, perhaps despite his inability to contribute as they and he might have liked. So Joe, while I try and work out whether this would be a male or a female skeleton from the pelvis, where are we placing this on our early medieval scale of dates?
This cemetery is Walkington Wold in East Yorkshire, and radiocarbon dates suggest it's from the 7th century to the 11th century, so firmly in the later Anglo-Saxon period, but in use for quite a long period of time.
And I'm going for this curve in the pelvis here, and I'm seeing that same U-shape that we've seen before that suggests that this is a male.
Absolutely. So if we look at this one, you can see we've got a narrow angle underneath here, and it's not concave at all. There isn't a ridge, and it's nice and flat. So this is, again,
if this was a
accurate.
female, you'd expect this angle to be greater.
Yeah, it would be a much greater angle, but also concave, so cutting away a little bit, and you'd expect to see a ridge coming up the front in this area as well.
And in terms of age, I'm looking at the top of these bones, and they look fused to me, which suggests an adult.
Looking fused. If we actually look at the joint surface in here, which is the pubic symphysis, this gives me an age range of 21 to 46, which is quite broad. But if I bring in the sacrum, where we have this slight fusion, I can narrow that down to lower than 32. So we've got an overall age range of 21 to 32.
It's fascinating, just detective work moving through the bones to help you wheedle your way down to a narrower date than you can start off.
Yeah, I mean, you sometimes start off with something that's impossibly wide, but by looking at multiple methods and seeing where they overlap, you end up with something that's better for that individual, because we all age at different rates.
There's three things that I've noticed about this skeleton, and I'm going to probably leave the most obvious till last. The first is that on the legs there is this weird texture to the bones. Do you know what's causing this?
Yeah, so this is classic post-mortem damage, and in this case, if we look in really, really closely, you'll see this kind of almost like little lines etched into the surface of the bone, and that's caused by roots. And so you often get acids secreted by roots that then etch their way into the bone. So the very outer surface of a lot of these bones has been basically eaten away by that process. And in this case, these bones were really, really friable when they were excavated. So they actually used a consolidant at the point of excavation to keep them as intact as possible. So all of these bones, or almost all of these bones, have been coated in a consolidant. I'm assuming PVA glue, but it could have been something else. And that means that in places we've also got little bits of soil still attached to the bones as well.
Would you say that that's kind of not ideal, but it's also the only way that maybe could get it out the ground?
Yeah, absolutely. I mean, you know, they've done really, really well to get as much of the skeleton out as, you know, complete as it is, given the obvious friability of the bones. And so you move down and look at the feet, and they're really crumbly and really incomplete. And, you know, you're losing almost all of the surface on this tibia just in here.
That almost looks like tree bark, doesn't it?
Yeah, it's a completely different texture to normal bone, but it's not pathology.
You can tell so much just from looking at the surface of it. So I guess the second thing that I'm noticing fairly obviously about this individual is that the torso is kind of all clumped together as well. Others that we've seen are laid out and we can see the vertebrae spaced out nicely, but this is very much a clump of stuck together bone. Is there a reason it's like that?
Yeah, and it's to do with this fragility of the skeleton in the burial environment. So in this case, they took the decision to block lift this, but by putting essentially scrunched up newspaper underneath to support it. And so you can still see we've got areas of soil in between the vertebrae where the intervertebral discs would have been, you can still see the ribs in partial articulation with the vertebrae. And you've got this layer of newspaper that it's sitting on, and then the sheet underneath that. And so I already know when the skeleton was excavated. But if I wanted to do some more investigation work, we could look at that newspaper, and it would have dated from somewhere like 1967 to 1969.
Yeah. And is it more or less helpful for you to have it like this? Because you say it's partly together.
Decidedly less helpful, because I can't pick up each individual bone, so I'm completely unable to say if there's anything happening on the back of those vertebrae or in between the soil. And because they've used the consolidant, it would actually potentially cause more damage to remove that now, so it's better to leave as it is.
So you've got no real way of looking for wounds or disease or anything like that in those bones?
Not as much as I would like to. I mean, I've looked at it in as much detail as I can with what I've got in front of me, but there's a small chance there's something going on here that isn't as obvious because of the way it's been excavated.
And I guess, there's an elephant in the room here. There's the last obvious thing that I've noticed about this individual, and that's that it's missing a head. There is no skull or anything. Is that simply an incomplete skeleton?
That's what we normally think. You see so much intercutting of burials or later features or plough damage that disturb parts of skeletons, and we've seen that in other individuals before. But in this case, this is something that happened around the time of death for this individual. So if we look at this vertebra here, this is the first thoracic vertebra, so we're looking sort of at the base of the neck, and we've actually got a cut mark just through the top of this vertebral body, exposing the trabecular bone on the inside. And we have another one that we can see just in here, slightly higher up, again exposing the trabecular bone of the process, the transverse process, which is the sticky out bit on either side of that vertebra.
So where you can see that smooth bit there, and then it exposes the spongy looking bit, that's where something is cut across.
This smooth bit here is the original bone surface, so the blade's kind of gone between the vertebral discs and then hit at this point here. And if I get the orientation right, what you should be able to see just in here is where that blade stopped.
Oh yeah,
so
it's a little notch.
A little notch,
yeah.
This injury would have decapitated this individual. It's unusual in that it's coming from the front, and the vast majority of decapitations that we see are from behind. But in this case, that little nick in there really clearly tells us that this one's come from the front. So is this a case where there's been some attempt to bloodlet an individual, slit the throat of the individual, or is it deliberately a decapitation? And is this something that happened when the person was alive, or were they perhaps killed in a different manner and then decapitated as a sort of mark of othering this individual in death? But certainly if they were alive, this would have ended that.
I guess throughout all of those options, however that happened, whatever order it might have happened in, what we're probably looking at here is someone who was executed.
Yep, this is very much characteristic of an execution blow. Unlike other individuals with trauma throughout the body with injuries to the neck, there isn't any evidence of any other injury elsewhere on this individual. It's just in the neck, and that's true for other individuals at this site. So there are 2 skeletons, this one and another one, and then 4 heads that have decapitation blows, 2 of them from the front and 4 of them from behind.
I think interesting when we think about this period of early medieval history in Britain, and again we're tending to think of it as quite a lawless period in which the country is fractured, but here is what is quite possibly a demonstration of law in action. We don't know what this person might have done, but he seems to have been executed, and the suggestion would be for a crime, I guess.
Yeah, and if you go back and look at the documentary evidence for the later Anglo-Saxon period, you start to see the development of law codes from different kings. And so we sort of start picking up the different modes of execution and also the kind of things where somebody could be executed. And in this case, decapitation is one of the ones that is mentioned. Hanging is the other one that's most common. And then you may see things like stoning or drowning, although they seem to be more associated with crimes typically committed by women, which is really interesting.
It's so frustrating, I guess, that we can't get any closer to what he might have done, but nevertheless he's being killed probably in a judicial fashion. What do we know about the place where he's buried then, is he buried on holy ground as part of the community?
So this is the cemetery plan for Walkington Wold, and this does not look like a churchyard at all.
And the bodies look very higgledy-piggledy.
They are. They're not orientated east-west predominantly. They're in all different orientations. We have some who are supine and extended, so lying on their back, but we also have some that appear to be lying on their side. Again, this one with the legs crouched up. We've got a quadruple burial here with 4 people in it, which again is less common. And it's actually centred around this ditch here, which is actually the ditch from a Bronze Age barrow. So this was the original Bronze Age burial that predates this mound. So Walkington Wold as a barrow was quite prominent in the landscape. It's a raised up area of ground, and it's also located on the boundaries of 200s. So 100 is the administrative district, as I'm sure you already know, but it's also close to a routeway. So this is somewhere that was visible to people moving across the landscape, but as far distant from the community cemetery in the village as you could possibly get.
All of that is just so interesting when we think about the potential that this was a criminal, because you're looking at something that suggests very little care in the burials, very little concern for their fate as Christians.
Absolutely, and it's really interesting because we have documentary evidence that from the sort of 10th century we actually get law codes saying that criminals cannot be buried in consecrated ground, and that coincides with roughly when cemeteries are getting consecrated as opposed to just being a Christian cemetery. But these kind of cemeteries are in use from the 7th century, so it's almost like the practice was already there and they wrote the law code later.
And we add to that this is from an earlier barrow, so it's almost associating them with paganism rather than Christianity. And add to that again that this is on a routeway and on the border of 200s, and they're being pushed to the edge of communities, but also put somewhere that people will pass them, almost as if this is meant to be a warning.
Yeah, and I think it was. So the cemetery was in use for quite a long period of time, but we have relatively few burials. They're just spanning several hundred years, which to me suggests that this is something that was actually a really effective deterrent. It wasn't something that was used particularly commonly in this community, certainly for this particular cemetery, but it was something that was highly visible. And what's interesting is if you look at the cemetery, you can see these dots scattered around, and these are all skulls. So the paler ones have actually got mandibles attached to them, and several of those also have vertebrae attached to them. So we know that they were deposited as head with flesh, holding all that body parts together. The black ones don't have any associated bone, it's just the cranium, the top of the skull. That suggests that when they were deposited in this final resting place, there was no soft tissue holding those parts together.
So potentially a different practice again, in that these heads have been removed from a body but buried not necessarily with the bodies but straight away, whereas these may have been displayed in some way.
That's certainly one of the possibilities, and we have documentary evidence of heads being placed on stakes. There is no evidence of head stakes being used at this cemetery. The bottom of the crania are all perfect. We do also have a slight potential other reason, which is post-mortem disturbance. At Walkington Wold, it's not other archaeology, it's badgers. When it was excavated, it was noted this was the location of a badger set, and there are actually claw marks on the back of a skull. Can't be 100% certain that that's how they ended up separate, but I think it's actually quite likely.
Is there any hope of finding a head that might have belonged to this body?
It's really difficult. And so the first one is, as you've seen, the bone preservation is not great. So my gut feeling is that DNA preservation in this sort of area of the postcranial skeleton is not going to give us enough to do a match. We may get reasonable stuff from part of the head. So the petrous bone, which is where the ear is really dense and provides much better DNA survival, as do teeth. But getting something from this part of the body in this condition would be challenging. So I don't think DNA is going to help us, and annoyingly, because there is so much disturbance, it's really hard to match all of the bones together. So you've got the vertebrate that sits on top of this would have been in the cemetery somewhere, but we don't necessarily have it. So it's really hard to piece together whose head fits with whose body.
It looks haphazard, but it seems like it's meant to be haphazard. And you add to that, 13 people in 300 years, and we're maybe not talking about such a lawless time where people are being executed on a daily basis. This is a rare occurrence, but one that people need to be reminded of. If you transgress, this could be your fate.
Yeah, and it's kind of marking out the beginning of a judicial system in the country and law codes that evolved and changed through time. But you have the beginnings of that in this later early medieval period, following the conversion to Christianity, but also around the time of the development of the kingdoms. That's when we start to see these things being written down and discussed in more detail.
But interesting that they may just be catching up with what people are actually doing.
Absolutely.
Out in the real world.
Yeah.
We've seen 3 very different skeletons that give us a window into early medieval Britain. Jo's expertise and her ability to tell the stories of these people from their remains is absolutely fascinating and incredible. What have we learnt about early medieval England? Well, was it a violent and vicious age? Yes, it was. We've seen a young man who lost his life in battle with 30 wounds, perhaps surrounded by enemies. But we've also seen the care that he received, that he was taken home and buried in a graveyard amongst his community. We've seen a young man who suffered with leprosy, but who at the end was still buried amongst the people he'd lived around with care and respect. And despite some of that violence and lawlessness, we have seen the emergence of examples of the codification of law. We've seen a man who was executed as a criminal, who was thrown into a graveyard that was specifically designed to make a spectacle of people like him. And yet, in 300 years of use, there are only 13 people buried there. So perhaps violence isn't quite as prevalent as we thought it was. What strikes me most about this period in British history is it's still a time when people care for people. "30 years ago, 9 skeletons were discovered buried within Stirling Castle. Their identities remain a mystery, but injuries found on them suggest they all suffered brutally violent deaths. Dr. Jo Buckberry, a battle trauma expert, believes they date from 1296 to 1357, during the Scottish Wars of Independence. Today, Jo is going to reveal to us the clues that might help identify who these people were and uncover how they met their ends. And I'll be joining Jo to add some extra historical context to these grim discoveries. So Jo, this is our first one. This is in lots of pieces. Is this a result of being in a grave for so long?
Normally that's the kind of thing we'd think with a medieval skeleton. In this case, they're actually relating to around the time of death. So they sort of suggest us that this individual met a particularly brutal end.
So we've got a skull that's in innumerable pieces. That could be related to the cause of death.
Absolutely. When I slowly piece this together into its many pieces into an almost whole, we've got 44 separate fractures on the skull alone.
44 just to the skull?
Just to the skull. Now, that's not 44 separate injuries. There are multiple points of impact within that. So probably 8 or 9, thereabouts. It's quite difficult because we don't have all of the pieces. But when I pick them up, they actually fit together extremely well. And in some cases, the lines are really, really straight, which is really characteristic of perimortem trauma, so trauma that happened around the time of death. Occasionally it zigzags a little bit, but it's all moderately regular in terms of the breaks that we see.
So that gives us some kind of clue as to how this person met their end.
Absolutely.
Pretty brutally.
One of the problems we have with perimortem trauma is the timing of that. So if I wanted to say something happened before death, I'd look for evidence of healing. We're not going to see that on bone until 1 to 2 weeks after the injury occurred. And then in terms of the breaks like this tells us that the bone was elastic. It was able to move when the injuries happened. But we have various forensic studies that have told us that could be anything up to 3 months post-death. So it's actually, for me, perimortem's quite a wide interval. I'm working on the basis that these injuries did happen at the time of this person's death and they resulted in their death. But it's a little bit difficult to be 100% certain because we don't have the soft tissue evidence that a pathologist might use to pinpoint that down even further.
Yeah, but I mean, that's a shocking start. 44 fractures to the skull around the time of death. And now I'm looking everywhere else and I'm seeing shattered bits of bone. Is that also connected?
The vast majority of it is. Once you have a break in a bone, it's more vulnerable to break further. So some of the breaks are post-mortem, they happened in the buried environment, but other ones definitely happened, or almost certainly happened, I should say, around the time of death.
In 1304, as part of the First War of Scottish Independence, Scotland's resistance to England's attempts at conquest, Stirling Castle came under siege by King Edward I. A strategic stronghold, the castle changed hands several times and had been a symbol of Scottish defiance since William Wallace's victory at Stirling Bridge in 1297. By 1304, it was one of the few remaining places of Scottish resistance. Could the location of these skeletons indicate that they were perhaps killed and buried in one of the sieges during the Scottish Wars of Independence?
For me, the rib fractures are particularly interesting. This is a really classic post-mortem rib break. It's straight across the bone. Those edges are paler than what they are normally. It's kind of like completely across. So that's the type of thing that happens with dry bone when it's no longer got fluid.
So that's just from resting in the grave.
But then when you look at something like this, it's got these really deep zigzags. Dry bone doesn't break like that. I was fortunate enough to do a course on trauma, and the first bone I looked at had a rib with a fracture very, very much like this, and it was from a modern car crash. Piecing the evidence together, this type of fracture seems to be a lot more consistent with a really high force, high velocity impact. Some of them have a mixture of the zigzag and knot. Maybe this was in the ground part way through the decomposition process. It kind of gets increasingly difficult to be 100% certain on a few of them.
If we've got 44 injuries to the skull, do you have any sense of how many injuries this person suffered around the time of the death across the body?
Around 100. And each time I look at them, I find more things that look like their trauma. Every single rib has at least one fracture. They've got fractures to both of their clavicles, both of their scapulae, so shoulder blades. In this case, the fractures are quite modest, whereas in this case, the bone has completely shattered. We've got a particularly nasty fracture to the top of this humerus, so just beneath the shoulder.
And is it the zigzag that's giving away?
Yeah, the zigzag and also the texture. So the fracture in here, the surface texture in here is kind of regular. It's really hard to see this here because that bone's so thin. But if we look at this other fracture, it's this kind of slightly grainy but slightly smooth texture is really characteristic of something that happened around the time of death. Also, it's a very similar colour to the bone on the outside. So that has been in contact with whatever has stained this bone, this particular sort of yellowy orange colour, for the same amount of time, which is, again, more consistent with perimortem trauma.
This person obviously suffered some humongous trauma at or around the time of death, which presumably killed them. Do we have a date for when this person died?
So we have a radiocarbon date that puts this person firmly in the 13th century, so right in the right period for the Wars of Independence.
It's incredibly evocative to think of this person being involved in a siege at Stirling Castle.
Yeah, I mean, the important thing on this person is we don't have any evidence of injuries from a weapon. It's all these crushing injuries, sort of blunt force injuries is what we've referred them to, so anything with a large surface area. And it's very difficult to say exactly what happened, but this is not a person who died in a battle on a battlefield where we'd expect to see sword injuries and, other things like that. Absolutely none on this particular individual.
Wow. So just with the sheer amount of damage and trauma and being inside Stirling Castle with its position on this frontier between England and Scotland for so long, it's tempting to think about this person being caught up in one of the sieges and maybe hit by a trebuchet ball fired from outside the castle. And you can't help thinking we're looking at someone killed by Warwolf. Ordered specially by Edward I, Warwolf is believed to have been the largest trebuchet ever made. It was so large that it reportedly took 5 master carpenters and 49 other labourers at least 3 months to complete it. Eyewitnesses at the time report it hurling stones through the castle walls like an arrow flying through cloth.
It's quite likely that a trebuchet is what perhaps caused these injuries. We know that there were multiple things being sort of thrown over the castle walls prior to the Warwolf being built. So it could have been one of those earlier siege engines that caused the damage. In that case, you'd have something coming over the walls and hitting this person directly, which is that high velocity side of it. And the other possibility is it does relate to the Warwolf. I'm not aware of any deaths due to any of these things. There's nothing written down that I've seen so far. But my understanding with the Warwolf, it did actually demolish part of the wall of the castle. It's whether or not that falling wall could cause this level of injury, or if that is not enough velocity compared to something that's kind of got that projectile element to
there's
it.
one source that says Warwolf was so big and so powerful that it hurled a stone through 2 walls in one go. So that must have been a huge amount of falling masonry and stone everywhere. And potentially we're looking at someone caught underneath.
Yeah, it's certainly a possibility for this person.
Wow, so much evidence that you can tell just from what's laid out here, but this person clearly met a horrific end. And I'm really interested to understand, for a person like me who doesn't know anything about this, where would you begin trying to work out whether this is a man or a woman, an old person or a young person?
So personally, I would always start with the pelvis. If you think about it, the pelvis is where all the sexual dimorphism is going on in the skeleton. That's the sort of childbirth aspect for females. So when I look at this person, first of all, this angle in here is quite narrow. So that's the greater sciatic notch. And more importantly, when I look at this part, which is the pubic bone, which goes right at the front of the pelvis, the angle underneath is narrow, it isn't concave, it's quite flat. And there's no ridges on this side either. So all of those are really strong male characteristics.
Okay, so this kind of V almost shape here.
Yeah.
And the lack of a sharp angle on that.
Yeah, I mean, if you
Oyster
look at it, that's more like a 30-degree angle. If it was a female, I'd expect something more like 60 degrees between my finger and the side of the bone.
And how does this give you an idea of age as well?
So for age, I'd be looking at the joint surfaces. So we can look at the pubic symphysis, which is this joint in here, and we can look at the auricular surface, which is this joint in here. And what I'm looking at is the lumps and bumps, whether or not it's flat or if it's beveled, in the case of the pubic symphysis, if there's an edge to it or not. And in this case, it's got a few little lumps and bumps up here, but it isn't all the way over. So that tells me it isn't really, really young. But at the same time, it doesn't have a complete edge all the way around the bone, which tells me it isn't really, really old.
So this is a man in his 30s?
Yes, probably. I think my age estimate when I did this properly was 29 to 48. So yeah, bang on, 30s and 40s.
I'm impressed by myself already.
It's a good guess.
And what else points to him being a man on the skeleton? Is there anything other than the pelvis that adds to that?
Absolutely. So as well as looking at the pelvis, we'd look at the skull. His skull is a little bit fragmented, but we're looking at things like the size of the mastoid process, which is this lump here, which is just behind the ear. If we look at his forehead, you should be able to see he's got little ridges above his eyes. So those are our supraorbital ridges. And if I look at his mandible, he's got quite a square chin. So it's coming off quite square. And it flares at the back in here, so it's quite a strong, muscular jawline.
Joe, I guess I'm looking at his teeth and I'm thinking they look quite white to me. There's maybe some black dots on this one. Can you tell much about his health when he was alive from the teeth that are still left there?
Yeah, there's a few things going on. So first of all, the black dots that you came in here, the more orangey bits are just because his teeth have worn and they've exposed the dentine, which is the material inside the white enamel. But these black dots probably represent the beginnings of cavities in his teeth, so a disease we'd call caries. This one's probably going to be hurting a little bit. Not too much because they're quite small. As these cavities get bigger, you get more and more pain.
He's going to have like an annoying, dull ache in his tooth that might not be enough to send him to the dentist, but it'll be there.
Absolutely. And then the other thing that I can tell straight off is if you look at the front of his teeth, he's got this like darker coloured material attached to them. And so that's dental calculus, which is mineralised dental plaque. So this is the stuff that you brush off your teeth when it's soft. In this case, they've fully mineralised and they've stayed on there. So that's an indication of the level of dental hygiene you'd have, which is pretty typical for this period. And I've seen significantly more grim looking teeth than this set, I've got to say. And if you look on the inside, it's a little bit darker.
Yeah.
Just in there. And that's because this is right next to where the salivary glands are. So you've got more liquid in there, and we tend to see a higher build-up of calculus in that region.
So there's nothing in his teeth that would suggest he was in particularly bad health?
No, I mean, these are a pretty good set of medieval teeth.
Is there anything about this skeleton that tells us about the person's status?
Well, we know two things, really. The first one is where they were buried. So they were buried in a building that was known nowadays as the Old Governor's Kitchen. And when they were doing some building work in it and they excavated, they found a series of individuals, including this one, and also some debris from window glass and things like that, suggesting it was a chapel.
So he wasn't buried in a kitchen?
He wasn't buried in the kitchen. What's really interesting is that Stirling, we've got the Chapel Royal, which is still standing, but there is also documentary evidence for an earlier royal chapel. And the archaeologist who excavated the site believes that these individuals were buried in that lost royal chapel.
Unusual for people to be buried inside a castle in the medieval period. You would normally be buried in a local parish church or the parish church where you were from. So for them to be buried inside the castle, again, kind of hints at no option to bury them anywhere else.
If this was a normal death in the castle, you would have a funeral at the local parish church. And in this case, they didn't have access to that, perhaps, and therefore the chapel within the castle becomes important. So in that sense, do they have to be high status to be in that royal chapel? Well, I think perhaps they were, because he's got a series of small skeletal differences that suggest perhaps a smaller gene pool in the population he came from. And that's the kind of thing that you might see in noble families where people are marrying to kind of consolidate their wealth. And so one of the things that I think you'd find quite interesting is he's got a slight curvature to the spine, nowhere near as severe as what's seen in Richard III. But that slight curvature is something, and in this case, it looks like it's something that onset when he was a teenager, rather than something he was born with. He's also got two differences in his wrist. So there should be a little blip of bone sticking out here, which is absent. It looks like there was a separate part. And we've also got two separate parts in here of one of his wrist bones. And whereas that could be a fracture that hasn't joined together, there's no suggestion of a fracture on that surface. It looks much more like this was a congenital separation of the two parts of his bone. And then finally, on the sacrum.
Oh, wow. And so just for a layman, sacrum, we're talking kind of tailbone?
Yeah, tailbone, yeah.
At the back there.
This is quite common. We see this quite often. But his fifth lumbar vertebra is the one right at the bottom of the spine. It's kind of thought it's part of the sacrum. So it's fused on the side, but you can just see the remaining joints between the two on here. And almost every individual buried at Stirling Castle had an anomaly like this in the sacrum, which is far, far higher than any other medieval population I've seen.
Wow, I just wanted to step out between skeletons to think about that guy we've just seen. So we've got a middle-aged man's skeleton, probably had a toothache all of his life. But those injuries, over 100 fractures, it's incredible to think what he endured. I think it's tempting to consider him being hit by a trebuchet ball from Edward I's massive war-wolf trebuchet. But I probably shouldn't get carried away. I need to get back in and see what Joe's got for me with the second skeleton. So Joe, what can you tell us about skeleton number 2?
Well, I think it's now time for you to tell me what you've learnt so far. Where would you start?
What I've learnt is you start at the pelvis.
You start
Let's
at
go
the
straight for the pelvis. So I guess if I go for the pelvis, I'm seeing that same kind of deep V, sort of U shape in there.
Yep. Really narrow. It's actually even more narrow than the previous individual we've looked at.
So I'm saying that tells me it's male.
Yes.
Oh, yes. What does it mean that it's narrower?
It's just a range of variation that we see in individuals. For sex assessment, this is more likely in males, this is more likely in females, this is most commonly found in males.
What can we tell about the age of this person?
And so this person is really quite young. We know they're at least a teenager because their pelvis is fused into a single bone. However, it hasn't finished fusing, so different bits of the body join together at different times. And in this case, we have an extra piece of bone here that will have actually fused onto this crest.
So that's not broken off or anything, that's just never been attached?
It's not been attached, it's a completely separate part. And as this individual, if they'd lived a little bit longer, that would have fused into place, giving us the smooth edge that we normally see, rather than this really rippled, what we call an epiphyseal surface.
Wow.
And then using the method that we tried on the previous individual, we can look at the pubic bone again. And this has got those ridges and furrows really deep all the way down, and absolutely no evidence of any edge to that bone whatsoever. So that's right at the earlier age range for this particular area of the body.
And do you have an estimate for how old this person was when they died?
Yep, so looking across the whole skeleton at areas of fusion like this, I would place this person between about 16 and 20 years old, so really quite young.
Is there anything about this skeleton that gives away the status for this young person?
Well, it's another person from that chapel, which is a strong indicator. And he does also have a variation in the sacrum, which is unusual for his age group. Previously, we had fusion at the top. In this case, we're looking at fusion at the bottom. So he's got 1, 2, 3, 4, 5 sacral segments, and then an additional one at the bottom in here. And you can see where it's partly fused on the back. So this is the first segment of the coccyx, and that has fused onto the very base of the sacrum. And this is the kind of thing that happens increasingly often as you get old, but it's not something that you would normally see in somebody who died in their late teens. It's a little bit more challenging to find out more stuff about this because doctors aren't interested, so there's less written about it in modern populations. But this type of variation is more common at Stirling than any other population I've looked at.
And is that hinting again at a smaller gene pool, potentially a higher status person?
That's my interpretation of what's going on.
So combined with the fact that he's buried in that chapel, we're suspecting this is a high status young man.
Certainly a strong possibility.
So is this something that would have caused him pain in life?
Not really. I mean, the chances are that he had absolutely no idea that this was there. It's just one of those incidental findings that we have. But he did have something that may well have done. If we just move up into the spine. So what we've got in this vertebra is underneath this osteophyte, which is a bit of an outgrowth of bone, we've got this big cavity. And next to it, we've got these erosions coming around. And this is likely to be a very early stage of tuberculosis, a chronic infection, and one that only hits the bone in about 5 to 7% of people that catch tuberculosis will you see bony lesions. But this is in a really early stage of development. It's not impacting the next bone to it. But as that progressed, you could end up with total destruction of the body, collapse of the spine, and fusion of the several vertebrae into a single piece.
So we've got a young male who's already got a disease that would have caused him really serious problems if he'd lived a bit longer.
Yeah, absolutely. And then a very untimely end.
Something has happened to this person. Do we have any idea what caused their death?
We do have a few clues. So first of all, if we look at this rib in here, it's very small, but can you see that tiny little cut mark?
Yeah. It's a tiny little nick just across the rib.
Yeah. So that's looking like something has sort of stabbed into that rib. It's clearly really, really small because there's no injury on the rib that sat above it. There's a possibility that the bit that it was above it was lost at the time of excavation. We don't quite have all of it, but this is really quite a small injury.
Is that left front rib quite low down?
It's left and it's fairly low down, coming in kind of from the side.
So someone's stabbed something very thin and sharp
Into the
there,
chest.
and it's left a mark on that rib.
Yeah, you could puncture into lung tissue, which obviously is going to start to cause problems breathing potentially. That's not the only injury this individual has. And so if you actually look back at the skull, they've actually taken quite a nasty blow to the chin. And so if I hold the mandible together, you can see there's this fracture running up. And then when we look inside, particularly in here, you've got this kind of roughened edge, and that's basically where the bone has been pulled back, sort of peeling almost the surface off. And that's a really classic perimortem injury.
Yeah, and there's a zigzag edge to it again, which suggests...
A little bit, yeah. I mean, it's less of a zigzag in this case. It's a little bit uneven. And on this side, it's really, really sharp, which is really characteristic of sort of perimortem trauma. But it doesn't stop there. The force of that blow has come up and caused them to sort of like bang their teeth together. We've actually got a fracture through this molar tooth, basically broken that tooth in half, leaving it in the jaw.
So they've had some sort of blow under the chin.
Yeah, it's fractured right the way through into the upper teeth.
It's horrific.
Really, really nasty injury.
Warfare during this period was brutal. Armed with spears, maces, swords and daggers, death was violent and not always quick.
Do we have a sense then of whether that stab wound or this injury might be what killed this person?
I mean, this is not the kind of thing that would necessarily kill somebody. It's the kind of injury you could potentially survive. There are a few other fractures in the body, as well as the ones we've talked about. And again, they're not necessarily things that would have been fatal. The stab wound depends very, very much on how that impacted on the soft tissue. We've just got the bones left to tell us the story.
But it seems like this young man was caught in a fight.
The other fractures could be accidental, but that stab injury is suggesting that somebody else was involved and that person had a weapon.
Oh, I just wanted to come out and catch my breath from that one. To see someone that age, 16 to 20, that's younger than any of my children still are, and someone who has died such a violent death, a stab wound, and such a blow to the jaw that it's fractured his jaw and broken a tooth above it. And then to think that if he'd lived longer, he would have suffered with that tuberculosis that was already beginning to eat away at the bone in his spine. It really highlights the harsh nature of medieval life at Stirling Castle in the 14th century. Almost dreading what Skeleton 3 might have to show us.
So Matt, this is our third skeleton.
Can I have a go at trying to work out a sex thing? Because I know now, but I'm going to go and look at the pelvis.
Go for it.
Okay, I'm looking at that groove again, and that definitely doesn't look like the other ones that we've looked at. So they look like a V or a U kind of shape. I'm getting much more of a J almost from that. Does that mean it's different?
Yeah, so that's a moderately wide greater sciatic notch. That's the name of the groove. And that is looking more towards what we'd ordinarily see in a female.
Wow, so we've got a female skeleton here.
Potentially. So the way to take that further, which bone did we look at to kind of...
Pubic bone.
Pubic bone, yep. So if I look at this one in here, first of all, that angle underneath is really wide.
Oh, so where those male ones that we looked at were more like this shallower angle, there's much more of a gap there.
It's also a little bit concave in this side here, so it's cuts in. And I kept talking about there isn't a ridge. Well, this is the ridge that we're looking for. So it's called a ventral arc, and it kind of cuts away from the edge of the bone. And this is a really strongly indicator for this individual being female.
And what are you able to tell about the age of this person?
So once again, for the age, I was looking at the auricular surface, I was looking at the pubic symphysis, And in this case, you can see there's a little rim all the way around the outside. It's beginning to sort of sink in a little bit in the middle. So this one tells me this person's a little bit older. She was probably in her 40s or 50s when she died, so a bit older than the other individuals.
Okay, and again, if she's found in that chapel, we might be thinking someone high status. Is there anything on the skeleton that can help us get closer to that?
Well, once again, we've got one of those weird indicators of potential genetic difference. So if we look up here, this one is the first cervical vertebra, so the top vertebra of the neck. And what you should be able to see is this gap at the back. Now in life, that would probably have been filled with cartilage. It wouldn't necessarily have been open. But this is, again, it's an unusual skeletal trait. I've only ever seen 2 in the many thousands of skeletons that I've looked at over the years. And once again, I'm seeing it in this group of people from Stirling Castle. So it's building up this picture of potentially a smaller gene pool.
Incredible. So amongst those other skeletons, we have a middle-aged woman who appears to be possibly high status too. So do we have any idea what killed this person?
Well, once again, we've got some injuries, and this time they're on the cranium. If we look at the top of the skull, we've got these 2 rectangular injuries on the top. And initially you look at those, you think, well, what are they? Well, for me, a key indicator that these happened around the time of death is the fact that the bone had the ability to bend and flex.
So it hasn't got that dry bone thing that we saw a little bit earlier with that rib.
So what happens if you put pressure on the skull, it bends a little bit. And the fracture that happens on the inside is actually bigger than it is on the outside. So this is known as internal beveling. And internal beveling is a really good indicator that an injury is perimortem rather than postmortem, because you need that flexibility, that movement in the bone tissue itself to actually get that appearance.
Are we looking at the point of a weapon hitting this woman?
Yeah, absolutely. We're not entirely certain what weapon it was. Everything that I've seen sort of in exhibitions, in museums and in books and so on, they've all got a more square cross-section. So things like wall hammers or top spikes of pole axes, things like that. These are actually rectangular and never actually been able to match this up to a particular weapon with any confidence. Part of me wonders if the weapons that survive, the ones that we see in museums, are the really good quality ones, and maybe those made by the local blacksmith that aren't quite as perfect, perhaps were more rectangular occasionally than square. So difficult to say exactly what they were, but it's something fairly big.
But that hints as well at a violent death. So we're seeing a woman in her 40s or 50s being involved in similar violence to the men that we've been looking at.
This is clear evidence of a weapon of some kind. She's also got a series of fractures to the side of her skull in here that again are perimortem. This small piece in here once sat in there. And again, this is the evidence of that beveling. So that's the internal beveling on the flake that's come out. And we have some beveling in there. And then this piece came a little bit further around, again from this complex of fractures. So we don't know exactly what caused that, but that's 4 separate blows to this woman's head, which is quite unusual.
It doesn't look like an accident that somebody has deliberately levelled several blows at this woman's head in an effort to kill her.
Absolutely, and the angle of these 2, because they're right on the top of her head, you'd have to be above her and hitting down. So one possibility, you've got somebody who's on horseback or something like that and she's on foot. The other possibility is that you have 2 people who are standing opposite each other. She gets hit on the side of the head, goes down, and then these 2 blows come in after that just because of the angle. It's highly unlikely this was a face-to-face encounter.
So much for the chivalric knight protecting.
Absolutely, absolutely.
The skeletons found in Stirling Castle not only display the brutality of war, but the unfortunate reality of living during times of turmoil when no one was safe.
So we look at these 3 different skeletons. We have an older man, a very young man, a woman in her 40s or 50s, all buried in this chapel at Stirling Castle. Could they be related, or could they be the result of the same attack on the castle?
At the moment, it's difficult to say that from what we have. Really, to tell if they're related, I need some DNA evidence. So I'm waiting on some ancient DNA analysis.
So we could still be looking at a high status family, caught up in an attack on Stirling Castle and buried within the grounds of the castle because there was no other option at the time of the assault.
That's my working hypothesis as well. I think that's probably the most likely explanation for everything that we're seeing. And all of the individuals excavated at the castle have been radiocarbon dated, and we've got quite a nice tight date range for a group of them. And all of the ones that fall in that tight date range have evidence of perimortem trauma.
So it could even be that they were all victims of the same attack on Stirling Castle.
It would potentially. And the biggest problem here is the fact that the documentary evidence is talking very much about sieges, talking about the use of trebuchets, not so much fighting inside the castle walls, but we don't know the ins and outs of that. It's not always written down in that much detail, so it's kind of hard to fill in those pieces.
I mean, you can come up with scenarios. It's so tempting to fall into bear traps, I think, and imagine what happened to these people. But, you know, were they caught outside the castle and ambushed and taken back to the castle? Was there an unrecorded assault on Stirling Castle that did involve this kind of violence? Perhaps even our first skeleton caught up in a trebuchet attack. It's fascinating to think what happened to all of these people and the ways in which they might tie together. It'll be interesting to see what that DNA says.
Yeah, and I'm hopefully going to do some more CT work to try and look at those injuries, particularly on the first individual, in a little bit more detail, to tease out a little bit more information about particularly the ones where I'm not quite sure.
Yeah, so his number of injuries could go up.
Potentially, yeah.
Wow.
Could potentially go down, but I suspect they're going to go up.
Yeah, incredible.
Although Edward was eventually victorious, taking control of Stirling Castle in 1304, his success was short-lived. 3 years later, he was dead, and just 4 years after that, the castle was back in Scottish hands.
It's always so humbling and emotive to be in the room with remains of people who were alive centuries ago. It's incredible to think of those people. We don't know precisely when they died or what might have killed them exactly, but all of this points to Stirling's long, bloody history right on the frontier of the war between England and Scotland.
Last time, we looked at 3 skeletons uncovered at Stirling Castle, remains that helped us piece together the brutal story of its siege. Today, Joe and I are back, and we're going to dig a little deeper, because you had questions, and some of them might just change how we see what happened there.
So last time we were here at the University of Bradford, we looked at some skeletons that were found at Stirling Castle. People have been very, very interested in what you were describing from those skeletons, and we had a lot of questions and comments on that video. So I thought we'd take the chance now that we're here again to try and run some of those by you and get your thoughts on them.
Fantastic. Let's go.
So we've got, for example, one from Northern Captain 855 who says the injuries to the first skeleton might easily be from falling or being thrown from the castle walls. How do you
a few people mentioned this did they fall from a great height? And when I first started looking at the skeleton, I was absolutely thinking along the same lines. I saw another commentator question whether or not they could have been trampled through horses. And that's another thing I've been thinking about as I've gone through this. But the amazing thing about this research, and particularly the way I've been supported by Historic Environment Scotland, is I've been able to go and study some forensic cases. So I've been trawling through the forensic literature, I've been visiting forensic collections overseas and looking at injuries to people who died in these ways. And the one thing I can say is, if they did fall from a great height, it's a lot higher than Stirling Castle, because the forces to create the precise kind of fractures we have on those individuals are far, far greater than most falls from height that we see in that forensic literature.
Interesting. So next up we've got Finn Filker, who is asking about whether Stirling Castle tried to surrender prior to Warwolf, the big trebuchet being completed, and Edward I kind of refused to accept the surrender until he'd fired his brand new weapon. And that the sources do support that. You know, Edward spends an awful lot of money building Warwolf. He's had materials gathered from everywhere. He's had his engineers working on it day and night. And it seems like he's a little bit annoyed that then Stirling Castle want to surrender. So he thinks, I've put all of this money and effort into this trebuchet. You better believe I'm going to finish it and fire it so you can all wait inside there. And then as soon as he's managed to fire it once, then he's happy and he accepts the surrender of the castle.
Yeah, he's basically got to play with his toys.
Yeah. Big boys' toys. So next we've got Speak Up, Rise Up 4549, who says that first skeleton looks like he was used as werewolf ammunition.
Absolutely. And again, it's part of my thought process. And I've been working with a colleague of mine, Patrick Randolph-Quinney, and we've been looking at this skeleton again in even more detail. We've picked up even more fractures on the postcranial skeleton, so from the neck down, including a high proportion of tiny fractures to the back of the spine that when I first recorded them, like, I'm not sure, I'll leave them as possible, but I'm not going to record them. And he's like, no, I think they really are, which was fascinating. We kind of used magnification. And from that work, we've been looking at the orientation of every single blow. And from what we can tell, it's looking like this person was hit from behind and quite high up across the shoulders, perhaps the back of the head, but also that they were perhaps crouched in a sort of crouching position, which is less likely to be the case if they were being used as werewolf ammunition.
Bill Akers 6082 says, didn't they throw people infected with all sorts of diseases over the walls hoping to infect the enemy? It's not a common tactic. It's not unheard of. So this is one of the ways that people think perhaps the Black Death was spread in particular. But I don't think it's a common tactic, and I'm not sure it's something we particularly see happening in the Scottish Wars of Independence. Mr. Sunlander says maybe he was a Scottish rebel hurled by the trebuchet at the wall just to make a point. Edward, always keen to make a point. Well, we've already said that with the werewolf is keen to make a point.
Absolutely. And, and again, it falls down to that really careful mapping of those fractures. And I think it's highly unlikely that that would have happened. He would have had to have hit the wall at a very specific angle that is much more consistent with somebody hunching down, rather than if you're being flung, you wouldn't be in that position, but also likely that they were standing. And so the force that's running through the body and through the legs to the floor contributing to the way that those fractures are happening. So I think, been thinking about it, not convinced for that one.
Yeah. So the next comment came from Long Snapper 538, who is a dentist who wanted to talk about teeth. And he says, amongst his comment, that's a lot of wear on those posterior teeth. We don't see wear like that, even on most 80-year-olds. He had paranormal habits like tooth grinding from stress or something like that.
So if this was a forensic case, absolutely, 100%. And, I've talked to forensic anthropologists who said, or people working in forensic situations who find the difference in that rate of wear between modern people and people in the past really quite astonishingly different. For the medieval period, there was a lot of coarseness in the diet. So in particular, when you're grinding flour, because it's been done on stones and it's also not then being sieved at a really high grade, you're going to get bits of grit into that food and that wears your teeth down. And so teeth wear is a much faster in the past. And I've actually got a few props to explain how we work it out, if that's okay.
Yeah, I mean, that's great.
So this is a model. And so we've got a baby with all of the teeth under the gums. This one's a young child and their first permanent molar hasn't erupted yet. We then get one in here where that first molar has actually erupted, and that happens at about 6 years old. We then don't have the model, but when you're about 12, this second molar would erupt and hit that biting surface again. So if you take a series of 12-year-olds, you can work out how much wear you get in 6 years, so 12 minus 6 on that first tooth.
Yeah.
And then third molar is going to erupt around about 18, something like that. So you can then say, okay, the amount of wear on the second tooth is 6 years of wear, and on the first tooth it's 12 years of wear. And you extrapolate out from that, and you end up with a chart of dental wear, going from really early levels of wear, which our individual was looking somewhere in here with very little exposure of the dental dentine inside the teeth, whereas somebody who was in their 80s would be having very, very little enamel left, if any teeth, and may well have lost them all due to the excessive wear. So just in here we've got virtually no enamel on the tops of these teeth, but enamel all the way around the outside. And this is something that's more consistent with somebody who died between sort of 30 and 50, that kind of region. So dental wear was far, far greater in the medieval period than it is today.
Right, and probably down to just a coarser diet, coarser
absolutely.
food that you're chewing on, wearing your teeth down faster than you would expect today. Right, our next comment comes from Nimitz 1739, who says, 13 minutes and 9 seconds in the video. Interesting that he had a cavity. I thought cavities were a modern thing because we have a lot of sugar in our diet, and they pretty much had no sugar in their diet unless they were royalty.
So first of all, it's not just sugar that's going to cause caries. It's any form of carbohydrate can then create sugars when they're sort of like degrading down, and it's that sugar that stimulates bacteria and acids from the bacteria that create that particular cavity.
I think when you think about it, the medieval diet can be quite sugary because the amount of honey and fruit and things like that people are consuming that is full of sugar, but it's not processed
sugar. It's not processed sugar, and it's not, the quantity is lower, and then because of that, the rate of caries that we see in the population is far lower than in the 19th century when sugar is really common.
Yeah, fascinating. South Mark just asks St Catherine's Wheel. I think we're back to our man with lots of bone fractures.
Absolutely, and again, it's to do with the forces. This is a really high energy kind of trauma. It's the sort of things that I was seeing in people who died in car crashes, or who were hit by a train, or more recently I've seen images of somebody who died in an explosion in the 20th century.
And St Catherine's Wheel was a medieval form of torture and execution where you were manacled to a wheel. All of your bones were systematically broken with a hammer of some description, and then you were eventually beheaded on the wheel. And that's where the firework gets its name from as well. So next time you're cheering at a St Catherine's Wheel spinning around and round,
really think about it a bit more.
Yeah,
but yeah, that's all life force trauma.
It's from a medieval torture device. Joshua 7233 says the slash across the chin almost looks like it could have been done to someone on foot via an upward sword slash from horseback. So perhaps an infantryman being attacked by a cavalryman.
Possibly, but I would say that the injury we're seeing is blunt force trauma, not sharp force trauma. So it's not looking like it's a slashing injury. It's something with more force. But certainly the angle of that force appears to be coming from in front and potentially below, forcing it upwards. But when you're not using a sword, they could be in much closer proximity to each other.
Yeah, so it could be that action, but perhaps it's something, a mace or...
Yeah, something like that, yeah.
Yeah. User Y9HV2PB2Q says, what would have been square or rectangular are metal nails, bolts and construction pieces. So possibly the female skeleton that we looked at last time was caught under some collapsing structure, a falling beam or something like that.
And again, this is again falling down to those forces required. It takes quite a lot of force to fracture the skull. And if that had been the case and that had fallen with enough force to break the skull, I would expect to see blunt force trauma around the impact of the beam rather than those nails or bolts being forced in. And the force required from something like that is unlikely to have been the case. And I think we're looking at something that has spikes on it.
Yeah. And I do quite like that people are asking questions that you've asked as well, that you've
absolutely,
investigated already, but it's great to be able to respond to them and give them some clarity about whether those things are possible or not.
And it is an investigation. It's a mystery, and you're trying to piece the pieces of the puzzle together. And to do that, I'm using a lot of sources that are out there in the literature. I'm kind of relying on other people's research and talking to people, exchanging ideas to build up a picture, and that's how science develops. That's how we learn from each other and piece all these things together and figure out what's going on.
Yeah, well, thank you so much for taking the time to do that, Jo.
No, I'm happy to do so.
Remember to let us know your thoughts and theories in the comments below, and stay tuned for future episodes. On the island of Gotland, in the heart of the Baltic Sea, construction work in the 1920s uncovered something extraordinary. Just outside the walls of Visby, beneath the soil, lay mass graves, hundreds of skeletons, many still wearing fragments of armour. It quickly became clear that these were the fallen from a single medieval battle, buried where they died and left largely undisturbed for nearly 7 centuries. What was discovered here would become one of the most complete archaeological records of medieval warfare ever found. Today, a team of specialists, archaeologists, osteologists and battlefield historians have come together to re-examine this battle.
And it's brutal.
By analysing the remains, exploring the site itself and carrying out experimental testing, they aim to prove what weapon caused some of the gruesome but puzzling injuries, and better understand the final moments of the men who fought here. In the mid-14th century, Gotland and its city of Visby were a major trading hub, wealthy, connected and strategically placed on the key Baltic Sea routes. Control of Gotland meant control of commerce. In July 1361, the ambitious King Valdemar IV of Denmark landed on this island with a professional army determined to seize that prize. What followed was a devastating clash when more than 1,000 defending islanders were massacred. What makes Visby unique is what happened next. Many of the dead were buried in mass graves, still wearing their armour. That decision preserves something incredibly rare: physical evidence of how they fought and how they were killed. Today, the site of one of these mass graves is marked by a single cross. Here, Joe Buckbury, Pat Randolph-Quinney and Tony Pollard discuss the grisly reality of that burial.
So welcome to the site of Solbury Convent. This is the site known as Korsbetningen, that those who fell during the Battle of Visby were recovered and buried here under the direction of the nuns. And so in the landscape around us, you can see the stone walls of the convent behind, but there would have been 4 mass graves. There still is one mass grave out there that's been unexcavated, a 4 mass grave that contained the remains of the armour and the bodies of those who fell at the Battle of Visby.
A veteran of many battlefield excavations is conflict archaeologist Tony Pollard.
How many dead bodies are we looking at?
1,300, thereabouts. Well, actually, the documentary records indicate about 1,800 falleth,
Yeah.
of which we haven't recovered that full amount
Yeah.
of bodies. So that's a lot of dead people.
Yeah, and the mass graves, we've got a minimum of 1,085, but that's a minimum and it could be higher
Yeah.
just from what's already been excavated, and we know there's another mass grave.
Well, I think parallels might be if we look at, for instance, Waterloo, where I've worked for a decade or more now. We know from the historical accounts that local people were recruited to clear the battlefield and bury the dead in the 10 or so days after the battle. And that's almost immediate. And there are records of 100 locals being hired basically to dig the pits. I guess the really amazing thing at Visby is we have bodies buried in their armour.
Armour was valuable, so burying it still on a body was very rare. But the summer heat may have had an impact.
The battle was in July, if I remember correctly.
Yep.
What's that going to mean in terms of the bodies and how they would change following
It
death?
would be horrific. So they would very rapidly go through rigor mortis, they would begin to bloat, they would begin to purge. And that's in addition to the sheer amount of bacteria that's come from the guts through gut wounds and opening of body cavities. You'd have had amputations, you'd have had limbs lying around, and how you actually, the smell would have been astonishing. If you're looking at 1,800 bodies, that is immense. The only way to describe it is a pile of putrefying flesh.
So we're looking at speed. That's probably the overarching thing.
And biotoxic, and no matter how hardened you are to these things, the smell, this gets into your hindbrain. It's a primitive response.
The remains from this mass grave are now preserved just a few hundred yards from the battle site in the Gotland Museum. Cut marks, crushed bone, and pierced rings of mail reveal the violence of the battle and the final seconds of the men who fought here. Joe Buckbury has come to take a closer look. Joe believes these wounds point to a chilling conclusion.
The remains were essentially disarticulated at the time of excavation. That means that their bones were separated out from the bodies. They will have been buried as bodies, but the process of excavation separated the bones out. So we've got this minimum of 1,085, and we have many, many more people potentially buried that have not been excavated.
The majority of these bodies belong to the Gotlandic defenders. The island had no standing army. It relied on a local militia. These defenders, largely farmers, craftsmen and townsmen, lacked training or battlefield experience. Confronted by professional Danish soldiers near the walls of Visby, they stood no chance.
The vast majority of injuries that we're seeing on these individuals happened around the time of death, and the majority of those are sharp force, which means it's some kind of a bladed weapon. So we're thinking swords, axes, scrammus axes, and that type of weapon. And the injuries were across the bodies, but actually a really high proportion of them were on the back of the legs. So we can see here there are 3 tibiae that represent many, many more in the assemblage, with these sharp force hacking injuries to the back of the legs, which essentially would have incapacitated the individuals, preventing them from being able to run away or escape the battle that was ensuing.
Amongst the bones, there's one skull in particular that has puzzled archaeologists. It's covered in square punctures. Ronja Borgling from Uppsala University has been investigating what weapon may have caused these gruesome injuries.
So this skull is one of the ones I have been working on for my project, and I find this one very interesting. I have been focusing on the puncture wounds, and on this one we can see it's 7 of them, and there's also a small couple of divots as well. And what's really interesting about them is that a lot of them are paired, so you can see that they are from the same weapon with spikes. You can see from some of the church art that they have depictions of spiked clubs, and it could be that this is a spiked club then, because you had the paired ones, then it's from the same weapon, and also you got the depictions. So it would be probably some kind of spiked club, or maybe a warhammer or something with spike, but when it's paired, it needs to be some kind of club.
Having looked at the skull, it's time to turn our attention to the weapon. Something deadly would have been needed to cause these deep punches and crushing impacts. Pat Randolph-Quinney from Uppsala University believes he's found a candidate.
Yeah, so what we've been doing is trying to emulate at different stages of the experiments the type of damage that might occur on the material from Korsbäckningen, so from the mass graves. Ronja's project is focusing on these square or rectangular defects that we get in the skulls, and we've been trying to determine whether or not they've been caused by crossbow bolts, for instance, so projectile weapons, or whether they're actually been produced by a fearsome battle club, spiked battle club. So this is a replica of a horrific weapon that's been made by Peter Jonsson, who's a swordsmith, and he's based this on Gotlandic designs, which is found in church carvings, and I think also in wall paintings.
Yeah.
And it's depicting, so weapons probably used by the Danes, and it's depicted of the invaders when they come to the island. And it's,
So when they say Gotlandic weapon, it's not one that the Gotlanders
no,
use to
what's
defend.
found, yeah.
It's found in Gotland.
So
and
these
tend to be used
spikes
by
are
the
found
Danes.
in the graves at Korsbäckningen, so the common mass graves. And basically it's a weighted bore with spikes inserted into it and a long point here. And you can swing it, you can thrust with it, you can defend with it. And when it hits things, it causes very, very nasty square
holes.
defects.
Yeah.
Today, we're going to be putting the weapon through its paces. To do that, the spiked club, along with the medieval reenactor who'll be testing it, are both covered in sensors. This will allow us to track the range of motion, speed, and power generated to understand how the weapon might have been used. But to do this, we need a target to hit.
So what we've done is at this stage we've taken cattle bone and we're placing it inside ballistic gelatin. So it gives it a coating, it gives it a bit of flexibility and resistance, and then we can wrap arm around that, so we can put chainmail around that or leather around that.
So the beauty of that ballistic gelatin is the ability to us to actually see the track of those injuries through the soft tissue or the proxy soft tissue before hitting the bone.
Yeah, so
Which
exactly.
gives us more, yes.
Exactly like you would do if you were doing ballistic testing. So you can see the entrance, you can see the exit, and see where it interacts with the bone.
The puncture wounds on our earlier skull suggest a concentrated, high-impact blow. A spiked club like this could deliver exactly that. But we need evidence. So before getting to the cattle bones, we'll test it on a mannequin head wrapped in leather. If the resulting trauma matches what we saw in the museum, we may have our culprit. With our volunteer ready and the head in place, it's time to deliver the first blow.
Oh my God. So
Oh, that's
straight
bad.
through the leather. Big one through the cheek there.
One through the ear.
Was through the ear. But the spacing is. It's nice to actually have the
the
spacing
yeah.
lined up. So 2, and that probably, and then obviously one down here.
Oh, and actually,
Yeah, well,
Oh God,
on
yes.
the
Actually, I wonder if those two are
Two,
paired.
probably paired
Yeah.
as well. It's the same. That are the same.
So, do you think these look like the ones from the individual in the museum?
Yeah, I think it's similar because the spacing
Mhm.
in there and the ones, the ones Pat showed, there are similar spacing between them. So absolutely, I would say it's similar.
You might get one that's hitting vertically,
Yeah,
but the one next to it is coming in at an angle.
yeah,
Yeah.
So
Which gives us
forcing
these
its way
slightly
through.
different
Yeah.
shapes as you move through the cranium.
Yeah.
yeah.
It's really brutal and horrible.
Yeah.
Really horrible.
Shall we see it on bone now?
Yeah, I think so.
Next up is the gelatin-coated cattle bone wrapped in leather and then in chain mail. This will mimic the damage done to human flesh and bones. It'll be a true test of how the men defending Visby would have been wounded by this brutal weapon.
So
Yeah, got a really obvious
Yeah.
on the edge
right
there.
through there.
What about chainmail?
Oh,
Oh, here.
It's just
Yeah.
it's just gone. Geez, that
Straight
gets
through.
straight through the chainmail.
But what's our bone like on the inside?
Let's have a look. There we go. 2 wound tracks.
Yeah, and actually that one's really quite substantial.
Yeah.
So the lovely thing about the gelatin is it records the track. It's used for testing of ballistic rounds, so gun rounds. On there. And you actually can't see where, it's just open up there. We can see where the impact is at the base. That one's really obvious.
As you can see, it went straight through the chainmail.
Yeah.
Like it was nothing.
That's just nasty. We could actually afford to hit that one again.
Next, the team will strike the other side of the bone, this time without any protection.
Oh my God.
Oh, wow.
God, yes.
It's a 2.
Yeah. And this one looks very square shape.
You've got that real square shape and
Yeah.
that peeling coming up as
Yeah.
well as it's been pulled out
And then-
again.
And hitting the edge here.
Yeah.
So we're really interested to get a distance between those two as well.
Yeah.
If you'd have done this on the skull, this degree of impact force, that would have gone straight through, particularly the more set and the more thin parts of the cranium.
And also the soft tissue over the head is so much thinner
Yeah.
than that on a leg bone.
Yeah.
So, on a
Yeah.
leg. So you've got less soft tissue separating the outer surface from the bone.
Yeah.
And then you've got a thinner layer of bone for the penetration to
That's
go
lovely.
further.
So you can see that one's vertical.
And that's just an
Yeah.
angle.
Yeah, absolutely.
The results are fairly clear so far, but the team needs more evidence to say for certain.
Oh,
Wow.
the temporary cavity's definitely gone down to the bone surface.
Yeah.
You just can't see anything that's going on down there.
But again, once you take the jelly off, something might
Yeah.
be
Yeah.
more visible at that
Yeah.
point. So the chainmail's cut the leather in here. That's actually created a hole.
If this was going into a big muscle mass, it would sever fibres, push them out of the way, and then they would, when it's withdrawn, they would close back on themselves. But that could very easily sever nerves, arteries, veins, in addition to the muscles. And then when you actually impact on the bone, you cause fractures. You can, almost untold damage depending on which bone it hits, and with how much force. And this is, this bone is much, much thicker than what you would find in the cranium.
It's clear that this weapon can do massive amounts of damage without much effort. So now the team want to test what happens with a full force swing. Using the weapon with more force shows just how deadly it is. One of the spikes has even been lodged into the wood underneath the target.
Where did that spike go to?
Yeah, it's over. Yeah, it's a hole underneath.
Well, the board's split.
Yeah.
So the tip's just starting to poke through,
Yeah.
and it's lovely because it gives us a nice cross section of the wound.
Interestingly, a number of loose spikes were found in the mass graves, hinting that they may have been lodged in the armour and bone, just like this would. More evidence that this weapon was used in the massacre outside the walls of Visby. Now we've seen this brutal weapon in action, it's time to inspect the damage. Ronja boils the bones overnight to remove the gelatin, allowing the team to get a closer look.
That's incredible.
Yeah.
And the force
Yeah.
in there is penetrated all the way through.
Yeah.
Exactly. This is straight through, and you see this little nick here.
Yeah.
Yes.
Also from the paring.
Yes, and it's a very similar distance.
It is.
Here.
And you've still got the nice lift there. You've
Yeah.
got little micro fractures around there, but it's got beautifully got the cross section of the spike.
That fabulous square shape,
Yeah.
beautifully preserved.
Yeah.
That piece of bone, yeah. Which one of the experiments was this? Was this one of the run-up ones, or...?
No, this was actually the very first one where we used quite a regular force, so quite a precision.
Quite a bit of power, but not as much as some of the later experiments.
Yeah, and really placing the blow very carefully.
Which is why we've got such a direct hit.
Yeah.
I mean, actually, the positioning is almost perfect.
Yeah.
So here's another one.
Oh, that was our big radiating fracture,
Yes.
and it's still
We've
paired.
still got that wonderful square hole, and then, the radiating fracture.
A radiating fracture is when a bone is hit with such a great force that cracks shoot outwards from the point of impact, causing far wider internal damage than just the external injury.
If you can see it inside,
Yeah.
Yep.
it's radiating out from that.
And beautiful internal beveling, actually.
Yeah.
That really characteristic
Yeah.
shape that we see that I tend to associate with cranial bones rather than
Yeah.
long bones.
Internal beveling is when the exit point of a puncture is larger than the entry point, just like a gunshot wound. So if this impact were on a skull, like the example from the museum, then the larger internal damage would be directly on the brain.
And then we've still got the paired
Yeah.
area of damage, and it's still the same distance apart as the others. But that one's just nicked the surface of the bone, so that one's gone all the way through and caused this lovely fracture, and that one literally is just almost bounced off the surface.
I mean, this weapon's horrifically brutal.
Yes.
Yeah.
It's alarming just how much damage one swing is causing. So the two we've looked at so far were quite controlled shots, a lot of force, but quite controlled. So what do we think is going to happen when he was doing those massive swings with the run-up?
I mean, you'd think that you're putting more force into it, but I wonder whether or not it's actually going to, literally just deflect off the bone rather than actually go in. I think we have our answer.
Yes.
Oh my word.
It's just a little, glancing scratch.
It's so small.
It looks like a cut mark.
Remarkably, the full force swing has only left a small scratch on the bone rather than a deep puncture like we saw in the less powerful but more controlled swings.
And actually you can see little bits, residues of the metal
Yeah.
sticking to the bone at that point.
But it's got it's got a curved wall, which you see in a cut mark.
Yeah.
So it's sliced across, so it's lacerated the bone as it's moved through, rather than actually going into it. It's just bounced off it.
Yeah, and it's the only one on here.
Yeah.
It's nothing else.
And that could partly be the position of the bone inside the gelatin and everything else, that we may not have got the flatter surface upright. Yeah. But also the inability to control the exact placement of the weapon on that small target with the run up and the jump.
Yeah.
Which makes me wonder if during the battle it was being used much more as a precision weapon.
Yeah.
Rather than something that people are swinging around.
Yeah.
Which would make some sense, because the ability to do that run up and swing would be somewhat limited by other people.
Yeah.
And
in the
also
battle
by the
environment.
armor you're wearing.
Yeah.
Yeah. But also, I mean, this might be a really specialised weapon that maybe, you know, it's not an indiscriminate weapon. Maybe, you know, these people who are using it are, they're trained, they're focused, they know what they're doing with it.
Yeah.
The square punctures, the radiating fractures, the internal bevelling, the spacing between impacts. When compared to the museum skull, the similarities are hard to ignore. The test suggests that the weapon was not swung wildly, but used with precision, targeting vulnerable points at close range. This revelation gives a clearer image of what the defenders of Visby faced on the battlefield. The team look at scans of the museum skull to see if they can find more proof of their theory.
Okay, so what we're looking at here is a structured light scan, a 3D scan of the cranium, the skull that we saw in the museum.
And so this is the one with all of the puncture injuries at the back of the cranium.
Yes, so we spin it round, you can see this. So you've got a series of punctures. There's one here on the frontal bone. And then you've got a whole series on the parietals. Okay, so 1, 2, 3, 4, and then 2 big ones. And that looks very much like the one we just saw that went all the way through.
What's interesting there is that intersection between those two radiating fractures.
Yeah.
Which suggests that the one on the left happened probably milliseconds
before the other
one on the right.
Yeah, so if we zoom in on that a little bit, then you can see, so we've got a nice square one here. So that one's doing through vertically or perpendicular to it. And this one's coming at an angle.
Seeing that these punches were only milliseconds apart and on different angles is clear evidence that a spiked club delivered them in one blow. But it's not just the puncture wounds that are revealed by the 3D scans. It also exposes fine cut marks called striations, the signature of a slashing weapon.
So I'm seeing 3, I think it's 3, sharp force injuries.
Yeah.
And they're clearly hacking injuries because of the direction of those striations. They're coming into the bone rather than cutting along it.
Yeah. And there's a really interesting thing going on with this one.
Oh, yeah.
You can see it with both of them. But if I zoom in a little bit.
Those sort of scalloped edges.
Yep. And you've got 1 scallop, 2 scallop, 3 scallop, and it's the same here, and they're the same size.
I'm wondering what they might relate to.
We have an idea, and that he was wearing a chainmail coif when he was struck with this blade.
And they are so like those impressions we saw yesterday of
leather.
Yeah.
So the blade is basically coming down, it's cutting through. The chainmail itself is gouging an impression.
These impressions point to the victim wearing a chainmail hood like the other skulls in the museum. That protection may have stopped the sword swings being fatal, but that's when the spiked club comes in.
That wound there would have sunk in 10 centimetres. If you're looking at a minimum of 1, 2, 3, 4 impacts, that's a lot of overkill. But this could be an individual who's lying on the ground, he's blinded, he's thrashing around, he's still an opponent.
Yeah.
And this is one way of putting him down. If this had been a club, a solid club, not a spike club, his head would have disintegrated.
Yeah.
So this is about, penetration, probably Seeing that on the battlefield, would just generate fear. Going up against somebody with that type of weapon.
Yeah.
But it is very, very efficient, and it's brutal.
We've got evidence of an incapacitating but not fatal sword blow, followed by complete overkill with a spiked club. The team has learned from the testing that the club might have been used as more of a precision weapon, and it was also a weapon designed to generate fear. This all means that in July 1361, outside the walls of Visby, there may have been a specialist Danish soldier roving the battlefield using this brutal spiked club to execute the wounded defenders. The battle was a massacre. The unprepared defenders had no chance against the professional invading army. But now, 700 years later, their bones are still helping us learn about the gruesome reality of a medieval battlefield.